All right. Okay, so I've got my small syringe and I've got my morphine. Once again, if this was if it had a sterile cap, I would remove that. If not, I would scrub the hub and make sure that's nice and clean, okay? So I'm gonna get my small amount. So we've already decided, we've verified our orders, we know all of that. We're gonna be taking out 0.2 mils, okay? So I'm gonna do that once again, okay? As I said, I always like to push beyond, especially when you're dealing with like, there's not a whole lot in there. I always like to go above and beyond. So then it gives me the opportunity to push back and make sure I have the same amount, okay? So once again, I'm gonna get it, we've decided I've got a little bit. With bubbles, you can always usually you can knock those out, okay? And then once again, I've gotten May to come in, I've gotten her to check, make sure that I have the right amount, okay? Always verify your dosage before you dilute. Once it's diluted, okay? And you can't have there's no safety there with that, okay? So I've got my right amount, okay? I like to just use a flush, okay? So I'm gonna grab my flush. In this case, so I'm just not walking around with a needle in my hand like this, I can always just recap, okay? So I can recap my needle right here while I'm waiting, okay? So in this case, we know that we're, my needle over here, guys. Okay, here it is. Too much stuff on this is why you don't have so many things on your couch, so you can't keep up with everything. Okay, so I've got my needle there. I've got my flush. Okay, y'all remember what Miss D said? You can pull back. Okay, and that's an easy way to get that bubble out. Now in this case, I'm going to be actually taking a little bit of fluid out. We are only using 0.2 mils. Okay. Now, if I know the exact dosage, like if I know I'm going to be doing 4 milligrams of something or 2 milligrams of something, as a rule of thumb, I will knock out that much, okay? So I'm going to go over to a trash can, a sink. In this case, I'm going to just take out about a mil, okay? So I'm going to take that out, and then I'm going to draw back on my syringe, okay? In this case, I'm gonna draw back so I have plenty of room, okay? It's okay to have plenty of room. You wanna have plenty of room. The last thing you wanna do is not have enough room and drug is spilling out of the top. I've seen it happen, okay? That's not what you wanna do. So I've got plenty of space, right? I've got all that air there. So I'm gonna take my drug, okay? I'm gonna take my needle off. For some reason, I've got butterfingers today and can't seem to do. I'm gonna recap that so I can get this needle off. Okay, oh goodness. Okay, so I've got that. You want to stop this?